Hello everyone, my name is Caroline Cho, and today I'll be presenting on the mechanism of botulinum A and its clinical applications. Here's a brief overview of the content I'll be going over today. So to start, a brief introduction to myself. I am a rising senior at Arnold O. Beckman High School in Irvine, California, and I have a deep interest in clinical neuroscience, psychiatry, and child and adolescent development. I am also the founder of COI, which is a youth-led nonprofit organization aiming to increase neurodiversity education within local communities and elementary schools, and I'm also involved in my school's orchestra. So first, what is botulinum A? Botulinum A is derived from Clostridium botulinum, a bacteria that can actually be found in soil. Despite its origins, Botox has been safely used in the medical and cosmetic fields for years. In fact, since its FDA approval in 2002, Botox has become the go-to non-invasive cosmetic procedure, with a staggering 4.4 million procedures performed in the US alone in 2020. What's even more impressive is that the projections of the Botox market indicate that by 2028, the global market will hit $7.71 billion, which is a direct result of the rising demand for non-surgical aesthetic procedures and the expanding therapeutic applications of Botox. Additionally, it's important to acknowledge that Botox does carry a black box warning. This is the FDA's strictest caution, issued when a drug carries significant risk of serious or even life-threatening side effects. In rare cases, Botox can spread from the injection site, leading to symptoms similar to botulism, which is something both patients and practitioners need to be aware of. So how exactly does Botox work? The mechanism behind Botox is both fascinating and highly specific. To break it down simply, Botox blocks muscle contractions by preventing the release of a neurotransmitter called acetylcholine, or ACH for short, at the neuromuscular junction. This junction is where nerve signals communicate with muscles, telling them when to contract. Botox does this by cleaving a group of proteins known as snare proteins, specifically SNAP25. These proteins are essential for the release of acetylcholine. And when Botox cleaves them, it effectively halts acetylcholine release, leading to temporary muscle paralysis. This paralysis isn't permanent and it typically lasts for several months, particularly with botulinum toxin type A. This precise targeting is why Botox is so effective for both cosmetic and therapeutic purposes, and it's worth noting that Botox's ability to relax muscles without causing permanent damage is what makes it such a versatile tool in medicine. One example being relieving migraines, which is a direct result of blocking acetylcholine release and muscle contraction. Now let's see this mechanism applied in treating movement disorders. Dystonia is a neurological movement disorder characterized by involuntary muscle contractions that cause repetitive movements or abnormal postures. A common form of dystonia is cervical dystonia, where neck muscles are affected, leading to pain twisting or tilting of the head. Here, Botox plays a crucial role by relaxing these overactive muscles, thereby reducing stiffness and pain. Clinical studies have shown that patients receiving Botox injections for cervical dystonia experience significant symptom release that typically lasts for 3 to 4 months before a follow-up treatment is needed. Blepharospasm spasm is a form of dystonia that affects the muscles controlling the eyelids, leading to involuntary twitching or blinking, which can interfere with vision and daily life. Leveraging the muscle relaxing properties of Botox injections into the affected muscles provides substantial release. Remarkably, 85% of patients with blepharospasm report significant symptom release following Botox treatment, making it the go-to option for managing this condition. And finally, spasticity involves abnormal muscle stiffness that commonly affects individuals with cerebral palsy or those recovering from stroke. This stiffness can restrict movement and severely impact daily activities. Botox is used to target and relax the specific muscles that cause spasticity, thereby improving mobility and enhancing the overall quality of life for these patients. And by integrating Botox into their treatment plans, patients often experience smoother and more controlled movements, helping them regain functional independence. Moving on to another application, Botox is increasingly used in the treatment of chronic migraines, a condition that affects millions of people worldwide. For chronic migraine sufferers, Botox injections offers a significant relief. Administered every 12 weeks, these injections are strategically placed around the head and neck. Clinical trials have shown that this treatment can reduce the frequency of migraines by up to 50%, and considering that chronic migraine is defined as having 15 or more headaches per month, this reduction can be life-changing for many patients. Of course, as with any medical treatment, Botox is not without side effects. The most common issues are mild and temporary, such as discomfort at the injection site or headaches. However, it is important to be aware of more serious, though rare risks. In some cases, Botox can cause muscle weakness or even respiratory issues, particularly if the toxin spreads beyond the intended area. This is why Botox is contraindicated in patients with certain neuromuscular disorders. Looking ahead, the future of Botox is bright. Researchers are continually exploring new therapeutic applications, from treating depression to managing excessive sweating, also known as hyperhidrosis. The goal is to maximize the benefits of Botox while minimizing its risks, ensuring that more patients can safely experience its advantages. And finally, thank you all so much for listening. I hope this presentation has shed some light on the diverse and powerful applications of Botox in both the medical and cosmetic field. And I would like to thank my parents, as well as my mentor, Clara, for supporting me along the way, as well as Polygence for providing me the platform to share my research. Thank you so much.